Thank you for coming here in the Hanita booth. Uh, my name is Jiwon Jeong from South Korea. Today I will share my clinical experience with the pentafocal IOLs intensities. My topic is optimizing functional visions, the pentafocal advantage of the intensity IOLs. These are my financial disclosures. And the intensity have a lot of characteristics. The first one is the pentafocal diffractive optics. It makes more continuous depth of field, and the second one is to make pentafocality more sophisticatedly. The intensity use GS algorithms, Gershberg-Saxton algorithms. Third one is make optimal light distributions for each focal point use as defined dynamic light utilizations. And finally, light distribution are optimized by pupil size. As when incident light meets diffractive plates, each diffractive steps acts like a slit, as in the Young's two-slit experiment. So diffractive ray are made like this, and this diffractive ray combined with the base refractive optics, it changes its direction. So finally, we got the focal points in the eye. In conventional diffractive IOLs, and usually zero order makes their focal point on the retina, so they make a far focal point. However, the pentafocal intensity IOLs zero order makes their focal point in front of the retina. So I'm so sorry. They make the intermediate focal point. Also, negative orders array makes their focal point in the retina. So finally, we can get the 5 pentafocality in the eye. To make a sophisticated diffraction gratings, intensity use Gershberg-Saxton algorithms. Fresnel plate lens or diffractive IOLs are hard to calculate or made by simple mathematical equations because too small unit and hard to simply calculate exactly. So once each diffractive source amplitude are made, it transferred to Fourier transform and check target amplitude at each the diffraction orders, and through inverse Fourier transform, the final makes a diffractive pace. Repeated these loops make more accurately and optimal diffractive pace. This is GS algorithms. So this is example of the GS algorithms. To get optimal image, we can also use the GS algorithm like this. Left side is results of 10 loops of GS algorithm, and the right one is 50 loops of the GS algorithm. You can see here the more fine and optimal image of the right side. So we can finally get the optimal diffractive geometry of the intensity like this. To make more effective focal point, the light distribution is also critical. So to get a patient's continuous visions, intensities, light distribution is also calculated by GS algorithms, and relatively symmetrical light distribution are used in, like as you can see, to maximize a function of the 5 focalities. So more light utilization is inevitable. Intensity uses light utilizations up to 93.5% compared to other diffractive IOLs 88%. It's a key factor to realizing the pentafocal theories. The results of 5 focal point with the dynamic light distributions, we can estimate the through-focus visual function by IOLs through-focus MTF curve. As you can see, there are 3 peaks and 2 intensified peaks between the 3 peaks. As you can see, another strong point is the pupil dependencies, using different diffractive profile and the different light distributions according to the optical radius. And the patient can see the more comfortably regardless of the pupil size. As you can see, another strong point is the pupil dependency. Using different diffractive profile, as you can see, the different light utilizations according to optical light. I'm so sorry. Results of a pupil aperture optimization with the dynamic light utilizations. You can see the near dominantly at the smaller pupil size and the far dominantly at the larger pupil size. You can see, and these are lens specifications, and the lens diameter is 13 millimeter in C loop and 11 millimeter in the plate type. Optic design is a posterior aspheric diffractive type and anterior spheric surface. Refractive index is 1.46 and induced spectral aberration is 0.13 micrometer. So this is my ongoing study about intensity IOLs. So we compared clinical performance of the intensity IOLs and the Clarion Panoptix IOLs. So enrolled eye were 28 eyes in intensity and 110 eyes in the Panoptix IOLs. After propensity scoring matchings by one, 28 eyes in the Panoptix were made. So we measured distance corrected defocus curve at post 1 month and 3 months, and the near intermediate visual acuity also checked at post 1 month and 3 months. Also contrast sensitivity were measured, and the photic phenomenon evaluation were done at post of 3 months. This is patient demographics. As you can see, there is a very similar demographics as shown. The results at post of 1 month, the post group had very good results in UCVA and the BCVA. However, at post of 3 months, you can see a difference between two groups. Usually at 3 months post-op periods, results are affected by some brain adaptations. UCVA was the minus 0.06 logMAR in intensity group and 0.01 logMAR in the Panoptix group. The PCVA is minus 0.08 in the intensity group and the minus 0.03 in the Panoptix group. You can see the better results in the intensity group. There are statistic differences between two groups, as you can see. In contrast test, the intensity have better results, especially in the low cycle per degree in both monocular and the binocular situations. Intensity post of 1 month photopic monocular defocus curve have more wider depth of field than and the superior results than the Panoptix, especially in the intermediate range. You can see a statistically superior results compared to Panoptix IOLs. Okay, in binocular situations, those results were more prominent, and the intensity have a better depth of field than the Panoptix, especially from minus 0.5 to minus 1.0 diopter range. Like this, and in mesopic situation, there are not much light. Usually you can't really see the difference between the different diffractive type IOLs. However, intensity IOLs, even if in mesopic conditions, you can see the differences, especially in the intermediate defocus range, and from minus 0.5 to minus 1.0 diopter range. In binocular situations, and where intensity have a better results. 3 months post-op, the results were quite interesting. You can see as the more widened the depth of field in intensity group. So getting more range of depth of field over time in intensity group means more easy brain adaptations. And the binocular situations also have a similar results. Its depth of field range are over 3 diopter range. Even over the 0.05 logMAR range, intensity have over 3 diopter range of the depth of field is dashed green areas. And the near visual acuity were very similar between two groups. However, intermediate visual acuity at 80 centimeters was better in intensity group. These results have a good agreement with the defocus curve results. In mesopic conditions, intensity group have better results than the Panoptix at 80 centimeter distance. 3 months of follow-up period, the near visual acuity were same as 1 month results. This is patients reported the photic phenomena resulting using the Zeiss glare halo simulators. Patients reported glare halo were very similar in both groups. There are no statistic difference between two groups. And the conclusions: intensity is the most advanced, latest full range of vision so far. And also, this is the first pentafocal IOLs using GS algorithms and utilizing dynamic light utilizations. It makes better contrast, and finally, the continuous range of visions. According to my studies, and the clinical outcomes are the superior to other multifocal IOLs in the visual acuity and the visual quality. Thank you. Is there any questions to my presentation? Yeah. Oh, I can't hear you. Say, yeah.
Would you prefer hydrophobic or hydrophilic?
Hydrophilic. I used hydrophilic one.
Hydrophilic.
Wonderful presentation, Professor. Thank you. From your defocus curve, I think the biggest advantage is that intensifier at minus 1.0 diopter, because it allows me to shift my refractive result, and I'll show in the next class. But I think it's where it stands off from the other lenses. What do you think?
What to say is the refractive results are different from the different IOLs. Is it right? Oh no, no. Yes, right, exactly. So the intensities of pentafocal IOLs have usually patients have the seamless vision, so from far to near. So the newly defined ISO 2024, there is yes, continuous vision range. Yeah, great. Have any other questions? Okay, that's it. Thank you.